Hi there, my name's Erica Berman, and I'm a registered psychotherapist with expertise in the area of infertility, pregnancy loss, perinatal mental health, and I assist members of the LGBTQ community to create families using donors and surrogacy. There can be some very, very different responses that men and women have to infertility, and society also reacts very differently to men versus women going through infertility or being child-free. So, for example, male factor infertility often leads to feelings of embarrassment or shame if men see their fertility and virility as a symbol of their masculinity. Similarly, women dealing with infertility will also feel shame, but often the prospect of never having children does not seem to have as big an impact on men's mental health as it does on women's. While men may be very sad and disappointed about not being able to have a child, most can accept this and move on with life. Many women, in contrast, may experience significant anxiety and depression about this and have a lot of difficulty accepting living child-free. Because of this, women often socially isolate themselves to avoid the pain of being around others who have become pregnant or have young children. In contrast, men typically do not feel the need to socially isolate themselves or withdraw from friends and family who are pregnant or have young children. This can also lead to conflict within the relationship as men want to continue having normal social interactions, but their partners are often reluctant to do so. Some of the concerns that women will have because of infertility is about being judged about their inability to conceive. But again, their primary concern is typically that they will never have the experience of being a parent. For men, their concern often becomes how much distress the infertility is causing their partner. A lot of the men I speak with will become very concerned that their partner may never again be happy if they are not successful in conceiving a child. There are also a lot of differences in terms of the pressures that society puts on women versus men when it comes to having children. Society puts virtually no pressure on men to have children. And fertility is generally seen as a woman's issue. A lot of people don't even seem to realize that men can have fertility issues. So women will often get a never-ending stream of unsolicited advice on lifestyle factors that people wrongly believe will help them conceive. In contrast, men's fertility is actually more clearly tied to lifestyle. Women struggling to conceive are often accused of causing their own fertility by being too stressed, thinking about it too much, worrying about the infertility too much, trying too hard to get pregnant. People will even encourage women to take less stressful jobs or quit their career in order to conceive, whereas nobody ever makes these suggestions to men, even when it's widely known that it's male factor infertility. Infertility negatively affects many aspects of people's lives. The couple's dynamic, work, social interactions, self-esteem, feelings of femininity and masculinity, etc., etc. But once again, the impact can be significantly different for men versus women, and it's usually greater for women. So even if infertility for a couple is entirely male factor, it is always going to be the woman who must undergo the majority of tests, take the medications, and attend the appointments and sometimes painful procedures. Women end up having to take a lot of time off work, whereas men may not have to experience any work interruptions at all. Men and women also tend to employ different coping strategies. They will sometimes throw themselves into their work. They will try to compartmentalize and enjoy other aspects of life that are going more smoothly compared to the infertility. Women find this very difficult to do. Instead, women are more likely to join infertility support groups, seek out counseling, and or confide in friends and family. Most men do not feel the need to discuss the situation with other people. In the case of male factor infertility in particular, they often do not want anyone to know that what the couple is dealing with is male factor infertility. There are a lot of resources and support available for both men and women who are affected by infertility, and most of these are free. So there's online support groups, whether they're live through Zoom or on Facebook, etc. And there's advocacy groups and even more and more organizations that will help couples with the cost of fertility treatments. Infertility can have an impact on people's lives even after they are successful in becoming parents. Sometimes that's just because of invasive questions that people may continue to ask them. It's widely known that assisted reproductive technologies can lead to multiple pregnancies, twins, triplets, etc. So if people have multiples, they will often get questioned even by strangers about whether they used assisted reproductive technologies. Sometimes there are inappropriate questions if people used donors, egg donor or sperm donor, for male or female factor infertility. People will ask questions about who the child looks like or how the couple managed to conceive based on their age. People may not want to disclose that they've used donors especially to complete strangers. And even if they are open about it, it may trigger feelings of grief and shame that people had hoped to leave behind them. There are strategies that patients can use to cope with the infertility as they go through this experience. Self-care is important, and that's not just, sleep, nutrition, exercise, but it's also a lot of self-compassion and compassion for each other when we're talking about heterosexual couples. I recommend to heterosexual couples that they may have to accept that the reactions and the experience of going through infertility is extremely difficult for them and different, but it's still challenging for both people in very different ways. The best thing that each of them can do is to simply validate how challenging it is for both of them and to think of themselves as a team as they go through it. I encourage people to seek out as much support as they need. The resources are there, and certainly anyone going through infertility is not alone. In Canada, 1 in 6 couples faces infertility. Thank you.